Okay, we're continuing with the book here, The Cancer Resolution by Mark Lintern. We're covering pages 59 to 84. He says, early diagnosis and screening, they trick people. They trick people into thinking they're living longer, but the natural history of the illness has not really changed. If you have a cancer that from the time it was 1 centimeter to killing the patient was going to take 10 years, and you screen and you catch it a little earlier, the patient will seem to have lived longer, okay? But it's only because you caught it earlier, not because you changed the natural course of the illness, and that very often is what happens. So screening makes conventional medicine look good because they're catching that cancer earlier than they would if they had waited till it became symptomatic. And some people think, well, oh, isn't that good? And I would say it depends. You know, if you want to know you have cancer for a longer amount of time, in that sense, that would be good. But if you're not really making any difference in the course of the disease, if you take a chemo that makes no difference and it just makes you sick, then you get sick sooner. So that's not necessarily beneficial. But it makes conventional medicine look good. You understand that? The lead length bias? Cancer death rates are a more accurate way to judge cancer outcomes, and they really haven't improved much. For about 85% of cancers with metastases, the chemo drugs have only increased life expectancy about 4 months. An insignificant amount when you take into account all the side effects. In general, for every 100 people who get chemo, only 5% will see a survival benefit. In Australia and American chemo research, only 2.2% of patients out of 100 showed survival benefit. And this is concerning when you look at all the side effects, you know. You got a small chance of benefit, but you got a pretty high, almost guaranteed risk of significant side effects. Some cancers have longer survival than others, like testicular cancer, which has about a 73% 5-year survival, but it's not clear if this is because of the chemo or because the cancer itself is not that aggressive. Chemo dramatically increases the risk of secondary cancers forming later, like in a childhood-treated cancer with chemotherapy. Surgery done on cancers diagnosed early accounts for the bulk of patients who are cured. In general, absolute risk is more important than relative risk. Relative risk is often used as a trick, like to compare two therapies, and one has a 1% improvement in survival, the other one has a 2% improvement in survival, and they'll say 50% better survival as the relative risk rather than the absolute risk is only 2%. The most dangerous part of a cancer is the cancer stem cell. Regular cancer cells are like worker bees. The stem cell is like a queen bee. Majority of cells in a tumor are regular cells, and only about 2% are cancer stem cells. And again, I got all the page numbers from the book if you want to look this stuff up. Cancer stem cells tend to be resistant to chemotherapy. Okay, they tend to be able to pump the chemo out of their cytoplasm, so they're not touched by it. Chemo often shrinks the tumor down by shrinking all the regular cells around the stem cells, but it's not shrinking the stem cells quite often, and that's a problem. The stem cells are able to pump the chemo out of their cytoplasm, and then the stem cells will come back more aggressive and regenerate the tumor. Researchers are now recognizing that unless the stem cells are knocked out by the chemo, the stem cells will just regrow the tumor. Chemo, despite shrinking the primary tumor, has a tendency to increase the risk of metastatic dissemination. So, all right, well, that's all for today. I hope you found that helpful.